Hi, good evening, everyone. This is Dr. Osborne, and I want to welcome you tonight to the webinar Ending Autoimmune Pain. And what I wanted to cover a lot this evening was just some live questions and answers. Many of you wrote in with your different questions in regards to autoimmune pain. And so I want to make sure we take some time to go through some of those things. But I'd like to start with just a couple of different fundamental premises that I want you to walk away from the webinar with. And that one is, the premise of autoimmune disease is there's actually only 4 known causes for autoimmune disease. And I think if you walk away from this webinar understanding anything, it's understanding those 4 known causes so that you can get into the right hands, you can find the right caretaker, the right physician or doctor to help you to try to ascertain these 4 things. So we're looking at autoimmune pain in general. There are 4 known causes. The first is food. Food being one of the most fundamental, and the one we've studied probably the most is gluten sensitivity. So gluten being a family of proteins found within the seeds of grain is probably the most well-studied food-based origin of autoimmune disease. But other foods can also trigger or contribute to autoimmunity as well. So we've got food as a big, broad, sweeping category. The second category of causes of autoimmune disease, one is chemical exposure. Perfect example of chemical exposure in autoimmunity actually has a lot to do with pesticides. So pesticide being one of the primary chemicals that we've studied that we know can trigger autoimmunity. Other things can trigger autoimmunity as well beyond pesticide. Other chemicals, heavy metals, toxins like lead and mercury and arsenic. Other things like different kinds of pesticides. So we have glyphosate, which is Roundup. We have atrazine, which is another type of weed killer. And we've got petrochemicals and plastics. So again, the field of chemicals can be pretty broad ranging, but it is one that you would need a good doctor to help you investigate as to whether or not that was contributing to or creating your particular type of autoimmune pain. And then third, so we said food, and then second we said chemicals, and then the third we can say vitamin and mineral deficiencies. A lot of people, and unfortunately a lot of doctors, don't recognize nutrition as a fundamental backbone to recovering from autoimmune disease. And so one of the things that happens is vitamin and mineral deficiency can set in, and some of these nutrients, some of these vitamins, minerals regulate the behavior of the immune system. Probably the most well-known and most well-studied nutrient related to, or nutrient deficiency related to autoimmune disease is vitamin D. And that's because vitamin D helps to regulate how strong of a response immune system cells will give. It's an immune regulator. Zinc deficiency does something very, very similar, as does vitamin D. But zinc and vitamin D aren't the only nutrients that are linked to autoimmune disease. They're just 2 probably of the most well-studied and the most well-identified as contributing to the progression of autoimmune disease. And then, of course, the 4th known cause of autoimmunity is infection. And that can be bacterial or viral or yeast or protozoan or prion. It can be parasitic infection. There are a number of different forms of infection that can trigger or that can contribute to autoimmunity. And so again, a good practitioner, a good doctor is going to sit down with you, and he's going to rule out infections. He's going to rule out chemical or heavy metal exposures or toxicities. He's going to rule out vitamin and mineral deficiencies. And he's also going to rule out food as a potential cause or a potential origin for the condition. Now, let's back up just a minute. So I've just given you 4 of the primary factors. And again, if your doctor begins by measuring hormones, the best thing to do is get up and walk out of the room, because you can't start measuring for autoimmune disease fundamentally first by measuring hormones. Hormones don't tell us why a person is sick. Remember that hormones are actually made out of vitamins and minerals. So if a doctor's not starting from fundamentals first, then we won't get a solid answer. We'll just get, oh, Mrs. Jones, your hormones are low, your hormone levels are deficient, therefore I'm going to prescribe hormones. Remember that medicine, artificial manipulation of chemistry, giving drugs for symptoms never fixes why the disease is there in the first place. So it's just very, very important that you grasp that concept, because if a doctor is wanting to prescribe a bunch of medicines as a cure, for your autoimmune pain or for your autoimmune condition, then it's definitely not going to be conducive to you long term in terms of your overall healing and recovery. So keeping that in mind. Now, I want to define a little bit of autoimmune disease. I want to kind of talk a little bit about autoimmune disease because, you know, one of the biggest questions that we got asked, and we polled everyone tonight. We've got over 1,500 people on this webinar tonight. But one of the things that I asked before the webinar started was, you know, what are the main conditions? What are the main pain points that you have or that you would like me to get questions answered to? And I think probably about 50% of the people polled answered that thyroid problems were one of the main concerns. Headaches was another very, very common, another very big one. And so in the sake of, I'm going to load a poll here. And what I'd like you guys to do as you're listening in is I'd like you to give me your feedback so that we can make this webinar kind of more customized to those in attendance. So if you could go ahead and start filling that poll out, you're going to see it pop up on your screen. And what I'd like to do is I'd like to kind of get some of your questions answered based on the way you're describing what you suffer with or are troubled with the most. But autoimmune disease, there are actually 190 different forms of autoimmune disease. And so understand that autoimmune disease is one of those things that it's when the immune system becomes overly reactive and confused, and it starts to attack our body's own tissues. And so a person can develop an autoimmune disease in any tissue of the body. We can have autoimmune heart disease, autoimmune liver disease, autoimmune skin disease, autoimmune thyroid disease, autoimmune arthritis conditions that affects our joints, autoimmune disease in the muscles, which causes muscle pain. So there are a lot of different forms of autoimmune conditions, and everybody who develops an autoimmune condition is going to develop it for a very, very unique reason or set of reasons. And so I just gave you a moment ago the four big origins of autoimmune disease. And I said that food, chemicals, infection, as well as vitamin and mineral deficiencies are all known to be causes of autoimmune disease. So how many different vitamin and mineral deficiencies could a person have? Because there are 40 essential nutrients. How many different kinds of infections are there? How many different forms of food or food allergy or food sensitivities are there? So you can see the endless possibilities of where a person might end up in those different categories. So again, I want you to understand that, you know, there's a lot of generalized advice on the internet today, and not that it's bad advice. It's just generalized. It's not specific. And even some of the advice I give you tonight is going to be generalized. But my premise of tonight's webinar is to really arm you with the knowledge where you can go to your doctor, you can go find a doctor, and you can say, look, I want to have this conversation. I want you to be very individualized with the types of testing that you're doing for me so that we can get to the bottom of why the problem is there. That's where you're going to find real long-term, long-lasting solutions. So as I look at the poll results, we see, you know, the types of pain that we're getting back in terms of what people are answering is muscle pain is predominantly the largest or the highest answer that I see, combined with chronic fatigue, the pain of chronic fatigue, and then running third is gastrointestinal pain. So, and then we have joint arthritis, which is a close fourth. So let's kind of go through some of these parameters. A lot of people don't realize that muscle pain, generally, why will muscles hurt? Well, one, you can have an autoimmune disease that's attacking the muscle, and so you can just have a muscle that's in chronic inflammation, chronically being broken down on a regular basis. But what happens to a lot of people is they develop muscle pain, and there is an autoimmune disease component. And so maybe they go gluten-free and they feel better, but they continue to persistently have symptoms or have issues. And what they're not investigating, or what their doctors are not investigating, are the nutrients that are necessary for normal muscle metabolism and muscle function. In my experience, one of the most common causes of chronic muscle pain actually happens to be iron deficiency. Then there are a number of nutrients that can contribute to anemia. Anemia means without oxygen, and muscles need more oxygen than any other tissue in your body to work except for your brain. So the brain and the muscles require the most oxygen. And interesting, we see that the brain and the muscles are the two most common symptoms that people have as it relates to their pain on this webinar tonight. So I think we'll answer both of these questions, or both of these areas of concern, by going through this. Understand that iron deficiency causes an oxygen deficiency. If you don't have enough iron, you can't make this special protein in your blood cells, your red blood cells called hemoglobin, which carries oxygen. And the two tissues that use more oxygen, or the most oxygen, one is your brain and the other is your muscles. So what happens when the brain doesn't have enough oxygen? We can develop brain fatigue and brain fog and memory dysfunction, memory disorders. We can have recall problems where we know what we want to say, but we can't quite recall the word. It won't quite come to us. So recall issues, very, very common. But then we also can have a lot of muscle pain. So lack of oxygen in the muscle leads to muscles that don't have longevity. So you could go for a walk and your muscles start to ache. You could try to exercise and your muscles start to hurt so bad that just trying to exercise one time can put you down in bed for 2 days or 3 days. For some people, exercise intolerance is one of their biggest holdbacks, and a big reason why it can happen to be iron deficiency anemia. Now, there are other forms of nutritionally based anemias. Some doctors will measure iron, and they'll do so by measuring a blood test called hemoglobin and hematocrit. But some doctors, that's all they'll order. They won't order iron itself, and they won't measure ferritin. So iron and ferritin are two other types of tests you can ask your doctor for to rule out iron deficiency anemia. But don't let them stop short at just doing a test called a complete blood count. A complete blood count test only measures hemoglobin and hematocrit, and it really won't give you all of the possible reasons why a person might be iron deficient. So you could miss the diagnosis by running that lab without actually doing additional labs. And those two additional labs that I would highly recommend, one again is called ferritin, and the other one is called just serum iron, your iron levels. So but again, there are other types of anemias that can be present, and these primary types of anemias can be B vitamin deficiencies. And probably one of the most common anemias, especially in patients with gluten-based issues. So if we look at the top two anemias in patients with gluten-based issues, one of them is going to be iron deficiency. The other is going to be vitamin B12 deficiency. And so vitamin B12 deficiency as a cause of anemia will lead to a different kind of anemia. It's called macrocytic anemia. It doesn't look like an iron deficiency on blood work. So if a doctor's not versed in reading labs to help identify a macrocytic anemia, and macro just means, very simply, it means large, right? Macro means big, cytic means cell. So large cell, big cell anemia is what that really actually refers to. And so people that have large red blood cells, those red blood cells should be small, not large. And when they're too large, that means they don't mature properly. So as red blood cells mature, they get smaller so that they can carry oxygen very well. And what happens is if they don't mature properly, they'll stay too large, i.e. macrocytic anemia. And as they're too large, they'll be very clumsy. They won't carry oxygen very well. So we'll have an oxygen deprivation that way. One of the most common kind of findings that people will complain of if they travel to somewhere of higher altitude. So for example, if you're like me, I'm in Houston where we're at sea level, but if you go to Colorado where you're at least 3,000 feet above sea level, so you're a mile higher, there's less oxygen in the atmosphere the higher you go up in elevation. And so what happens is some people who have a macrocytic B vitamin deficiency anemia is when they travel to places of higher altitude, they just can't function. They're super tired. Their muscles are super achy. They just can't function in those higher altitudes. And so what ends up happening is if they're on vacation, they sleep most of the trip because they can't properly function because of the anemia. And we call that altitude anemia, but more specifically, it can be a B vitamin deficiency. So these types of anemias are extremely common. And one of the causes, again, B12 deficiency. Now I put up what I would recommend if you go to a doctor and you get tested for B12 deficiency anemia. One of the types of B12 that's probably the most effective at getting a B12 correction is actually called methylcobalamin. Very important, methylcobalamin. There's another kind of B12 that a lot of doctors will recommend. It's called cyanocobalamin, and it's not very it's not a very good form of vitamin B12. It's very challenging and very difficult for our bodies to recognize that type of B12 and to absorb that type of B12. One of the other problems with B12 supplements has to do with the fact that they are absorbed through proper functioning stomach, one, and two, B vitamin B12 is absorbed in the small intestine. So unfortunately, if you have a gluten sensitivity, then the chances and the odds are that you've damaged the area of your intestine that absorbs B12 is very high, because the area damaged by gluten is the area, it's called the distal ileum. That is the area where most of our B12 gets absorbed, and that is not uncommon to see people with a history of gluten sensitivity have damage in that area of their small intestine, and so they just don't absorb B12 as well. So one of the mistakes is taking an oral B12 that you swallow, and so one of the ways to get B12 in you is to take a sublingual. It's absorbed through your cheeks. So if you do have a damaged stomach or a damaged intestine, we can absorb it into our bloodstream through our cheeks by using a lozenge. So again, methylcobalamin is the best form, and lozenge is the way that you want to go at that. In other words, you want to make sure that you're using a lozenge that is absorbed in the cheeks, as opposed to using something that you swallow and depend on your GI tract to do all that work. Because if your GI tract is damaged to the extent it can't absorb the B12, then you're going to have a problem. So I want to back up again just a little minute, because we started this whole conversation with, okay, what are the two primary forms of pain that you as the audience tonight are reporting? And so again, one was muscle and the other was brain. And both of those, very commonly, if you've changed your diet and you're already following a gluten-free diet, but you're still experiencing pain, anemia can be kind of a secondary problem that continues to persist. And so you really want to make sure that your doctor is ruling out or investigating either iron deficiency anemia or B vitamin deficiency anemia, because if you haven't had that done and ruled out, it's going to be a very, very tough road to overcome that pain. So going back to, I'm going to ask another question here. I'd like to just throw up another poll here. Let's see here. Give me just a second. I'm going to pull this next poll up. Okay, so the next question that I really want to just get some feedback from you guys is, how many of you are actually following or already on a gluten-free diet? Because that, that again helps us answer that first component or piece that we were talking about. So we'll give you a couple minutes to talk about whether or not you're following a gluten-free diet, and that gives me better feedback to help you as we go through this process. And I'm going to give a few minutes for that. And again, if anybody wants to, one of the things I'm doing tonight, so if there's anything that you find, I'm gonna be throwing up different things for you to check out and different resources. But so if any of you find that methylcobalamin is something that you have been diagnosed with B12 deficiency anemia and you want to grab that, tonight's webinar we're doing a lot of really really great promotionals. So if you want to get methylcobalamin, you can grab it at $10 off using that promo code up there as no pain. And we have a limited quantity tonight, so just make sure that if it's something you want to do, if something you need, that you tap into that before those things sell out. So as I'm waiting for that poll, I'm going to kind of go through some of these questions and give some answers. So one of them from JJ. JJ, what's the best way to correct a known iron deficiency? So one of the best ways to correct a known iron deficiency is, first of all, is to identify why you have it, okay? Because a lot of iron deficiencies are as a result, you can have nutritional deficiencies for many reasons. One is because you don't get enough in your diet. So let's just say that your iron levels are low because you're not eating enough. Well, the food sources for iron are primarily going to be animal meat and origin. Now, some people follow vegetarian diet. Some people don't eat enough animal meat. Some people, when they eat meat, they don't do well. They don't digest it well because they have a lot of predisposed or pre-exposed digestive damage, and so meat's just harder to digest for them. But we have to look at food sources of iron. Now, spinach is a really good source of iron. Nuts are a really good source of iron. Meats are a really good source of iron. Bone broth is a really good source of iron. So there are a number of foods that we can incorporate into the diet. So one, why are we deficient in iron? Could it be a nutritional deficiency? Or could it be a dietary deficiency because we're not eating the right foods? Is it underlying gastrointestinal damage? In other words, is the area of the stomach or the intestine where the iron is primarily absorbed, is that area damaged. Remember, we need lots of stomach acid to digest iron, and we once we have the stomach acid and we are able to cleave the iron from the meats and from the other foods that we eat, there's an area in the small intestine where iron is infused into the bloodstream. So is that happening appropriately? Is that happening well? The other thing that we have to consider with iron deficiency anemia is blood loss. Now, some people have gastrointestinal disease, so they're actually losing blood because they're bleeding internally. So there's a type of test your doctor can run. It's a stool test, and it measures for occult blood loss in the stool, and STOOL. And so knowing whether or not there's occult blood loss within the stool is very, very important, because that could be a source of iron loss that we don't even know about. Now, if you're a female of menstruating age, this is another source of iron loss. Men don't have iron deficiency quite as prolific as women do because we don't have periods. So if your periods are very heavy, this may contribute to iron deficiency. As a matter of fact, I had a couple of patients this week with very, very heavy periods with iron deficiencies as a result of that. So one of the reasons why periods might be heavy is hormonal imbalance. And one of the forms of pain, and I talk about this in my book, No Grain, No Pain, is I talk about the hormone pain cycle. There's 5 different major classes of hormones that grain, when we eat it, can disrupt. And so one of the things that happens as a side effect of that is if we have grain hormonal disruption, we're going to have heavier periods, or that's one of the possibilities is heavier periods, which leads to iron loss, which then leads to anemia, which then leads to fatigue, brain fog, and inability to exercise appropriately. So now we have this whole cascade of problems that begins. Now, JJ, I know that was probably a pretty simple question to ask, but I wanted to be thorough. Now, let me give you another piece of advice. If you're correcting an iron deficiency, if you've got a validated iron deficiency and you know why, it's very important to know why the iron deficiency is there before just going on a bunch of supplements. And that's because we don't want to have hidden blood loss and not know about it. That could mean cancer. That could mean a number of other kind of not so good conditions. So you would want a doctor helping you rule that piece out. But if you know why the iron deficiency is there, 75 to 100 milligrams of iron actually is a pretty good dose. When you're taking iron, take it in 25 milligram doses. Take it with food. Do not take iron on an empty stomach. It can cause nausea, will cause nausea. And if you take the wrong form, many forms of iron have they have gluten in them. They have gluten-based fillers in them. So if you are gluten sensitive, you actually are doing gastrointestinal damage by using that supplement. So you can never actually correct iron deficiency as long as that's happening. Now, going back to the poll, how many of you are actually on a gluten-free diet? We get back that 72% of you are on a gluten-free diet, 8% of you are not. Everybody knows what gluten is, but only 20% of you are sometimes on a gluten-free diet, sometimes not on a gluten-free diet. So it looks like the vast majority of people responding to the poll answered that they're following a gluten-free diet. Now, I'm going to back up just a minute because I want to make sure that you guys understand what gluten-free actually is. Again, my book, No Grain, No Pain, one of the reasons why I wrote it is because the misinformation and the information about gluten sensitivity that's currently out there focuses on 3 primary grains, wheat, barley, and rye, as being the 3 grains that contain gluten. But what I want you to understand is that those 3 grains are not the only gluten-containing grains. Now, gluten sensitivity, if we look at its origin, we actually discovered what we thought gluten was back in 1952. It was done at the University of Alabama, Birmingham, where 10 patients that had celiac disease, a protein was isolated called alpha-gliadin. And this protein, otherwise known sometimes as gluten, was discerned to be the cause of celiac disease. And again, this is back in 1952. And so it's been the primary focus of all the research up to that point. Now, here's what you don't commonly hear about the gluten-free diet is that it's okay to eat oats, that it's okay to eat corn, that it's okay to eat rice, and that there's no gluten in those particular grains. But let's define what gluten actually is. Gluten is actually a family of proteins. It's not one protein, it's a family of proteins found within all grains. And grains are defined as the seeds of grass. So by default, there's no such thing as a gluten-free grain. There's only such thing as an alpha-gliadin-free grain. Remember I said in 1952, some doctors discovered this protein called alpha-gliadin. otherwise known as, they were calling it gluten and alpha-gliadin. Well, we've discovered hundreds more forms of gluten since 1952. And one of the most prolific forms of gluten that rarely gets talked about in major scientific circles or in major celiac or gluten-sensitive circles is the type of glutens found in corn. And those types of glutens have actually been shown to be more detrimental than the type of gluten found in wheat. We've also got glutens in rice. We've also got glutens in oats. And even though you may buy a certified bottle or container of certified gluten-free oats, there's actually no such thing as a gluten-free oat. The name of the gluten found in oats is called avenine, and it does damage people with gluten sensitivity. So, I'm going to reset this poll, and I'm going to ask the question again. And what I'd like to do, and what I'd like you guys to do as I reset it is, and ask it again, is now that you kind of better understand the way we're defining gluten, which is gluten-free means grain-free, how many of you are actually following a gluten-free diet in that sense? And I'm going to give a couple of minutes for everybody to give answers to that new question, right? After we've redefined gluten as being a family of proteins found within all grains, not just wheat, barley, and rye, how many of you are actually following a gluten-free diet? Remember, before it was 72% of you. Let's give it a couple minutes and let's see what we get back. So somebody's asking me, Sarah's asking me, please list the price along with your supplement products that are popping up on the screen. Sarah, if you click that link there, it'll open up a new page for you, and the price is going to be there. Now, those promo codes tonight are good for tonight, and those are for $10 off. So whatever price you see on that screen, as you open up that next window, it's going to be a $10 coupon that you can use to get a discount on the product. Lisa's asking about buckwheat and quinoa, as well as to the fact of whether or not those two are gluten-free. And the answer to that is technically they do not contain gluten, Lisa, but buckwheat is so cross-contaminated that I would be very, very leery of trying to use it, because it only takes 20 parts per million of gluten to cause enough damage to create an intestinal inflammation for up to 2 months. So if you're buying a buckwheat and it's got some cross-contamination in it, then it could be a very big problem for you. Now, quinoa has actually been studied. There are 14 different proteins in quinoa that were studied back in 2012. And 2 of them actually were so similar to the glutens found in wheat, barley, and rye that they were found to cause intestinal inflammation. So quinoa is not something I recommend, even though technically it's considered gluten-free. So and Connie chimes in, I have a blog on quinoa. There is. If you go to glutenfreesociety.org, which is my foundation, and type in Gluten-Free Society and quinoa, you'll pull that article up and you can read more about that study. Okay, let's go down and see how we're doing on the poll. So now that we've redefined what gluten-free actually is, we said before 72% of you chimed in that you were actually on a gluten-free diet. Now only 38% of you are saying that you actually follow a gluten-free diet. So it's again, huge difference in terminology here. And so I want you to understand, again, the reason I wrote No Grain, No Pain, the reason I wrote the book was to dispel the misinformation that's been put out there to the common public about what gluten actually is. So you remember that a true gluten-free diet is actually a grain-free diet. And there is no such thing as a gluten-free grain. They don't exist. And I really, really, if you walk away with anything tonight, it's that I want you to understand that piece, because as you understand that piece, I think you'll do a lot better in your diet as far as getting ahead of the game. Now, if any of you are don't have haven't ordered or pre-ordered your copy of the book, I want you to just be able to do that tonight. And for anyone who hasn't ordered, there's a $200 coupon bonus kit for anybody who pre-orders No Grain, No Pain. In other words, if you get the book, now we're actually going to send you $200 worth of coupons and discounts and other things that you can use to buy a lot of wonderful different products. Some of them are grain-free cosmetics. Some of them are meats. Some of them are for seafood. Some of them are for supplements that are certified gluten-free, true gluten-free, not just wheat, barley, and rye-free, which again, a big, big difference. A lot of supplement manufacturers call their supplements gluten-free, but they're full of corn. And one of the things that we just do not tolerate is we don't tolerate corn in any of our products. So again, you can pre-order the book as you pre-order the book. You'll get those. Just follow the links there, and you'll get copies. You get your copy of the book, but then you'll also get access to that $200 bonus kit. So let's go ahead and answer a few more questions. Let's see here. Hi, this is from Jane. Hi, I'm hypothyroid and I'm gluten-free for 3 months. Of your 10 tests, I am low in zinc and iodine. My T3 and free T3, let's see, are below reference range, but other thyroids are okay. How can I heal my thyroid? Do I have to heal my gut, or does it take time since once going gluten-free? Both. So it depends on the status of your gut. So that's a great question, Jane. It depends on the kind of hypothyroid that you have. There are two major types of hypothyroid disease. One is autoimmune hypothyroidism, also known as Hashimoto's disease. Now, how do you know whether you have Hashimoto's, which is an autoimmune disease, versus just nutritional hypothyroidism? Well, there's a couple of tests that your doctor can order. One is called a TPO, a thyroid peroxidase antibody test. Okay, the other is called an antithyroglobulin antibody test. Those two antibody tests will tell you whether or not you're creating antibodies against your own thyroid or thyroid hormone. And so if you have positive TPO or antithyroglobulin tests, then you have Hashimoto's thyroid disease, which is a form of autoimmune thyroid disease. Now, that being said, there's also nutritional hypothyroidism, and nutritional hypothyroidism is not the same thing. A nutritional hypothyroidism means you lack the vitamins and or minerals necessary for your thyroid hormone to, one, be produced by your thyroid hormone to be produced, or for your thyroid hormone to be activated. So if we walk through, and I have a really good video on this, if you go to Gluten-Free Society and type in hypothyroidism, you'll pull up a nice video that I shot on the nutritional supplements necessary for your thyroid to work. But I'm going to run down through it real quickly. The first thing is your brain has to make a thyroid hormone called TSH, thyroid stimulating hormone. Now, for your brain to be able to make that, you need magnesium and zinc and vitamin B12. And once your brain makes that, and it's actually made in your pituitary gland, then the hormone will travel to your thyroid gland here in your neck. And what's going to happen next is that hormone is going to stimulate the production of T4. Now, T4 is sometimes also referred to as thyroxine, and it's the T stands for tyrosine, and the 4 stands for iodine. So T4 is actually made out of tyrosine, which is an amino acid that comes from eating protein. And so some people have nutritional hypothyroid because they don't get enough protein in their diet. And the 4 stands for iodine, which is a mineral, and iodine is primarily found in seafood. So you can also find it in things like seaweed and kelp, but iodine is primarily found in seafood in terms of the diet. So you need protein in the form of tyrosine, and you need iodine to make T4. But your body has to take that tyrosine and that iodine, and it has to assemble it. And so imagine there are little assembly factories inside your thyroid cells. And in order to put tyrosine and connect it to iodine, you have to have vitamin B2 and you have to have vitamin C. And if you don't have enough of either one of those two nutrients, you're not going to get adequate T4 production. But then what's next is the T4 actually has to be converted into T3. And that process requires another mineral called selenium. So if you're selenium deficient, you won't make T3 adequately. And then T3 has to talk to your DNA. T3 is actually the active form of thyroid hormone. It's the part of the thyroid hormone that communicates to your DNA about improving or increasing your metabolic rate. So if you don't have enough T3, there'll be a problem there. Or if you don't have vitamin A or vitamin D, enough of those two vitamins, because T3 has to combine with either vitamin A or vitamin D to talk to your DNA. Otherwise, again, your metabolism will never increase. But one of the other main nutrients that you need to make all that work is omega-3 fatty acids. And then so again, if we kind of back up and we look at all those different nutrients, it's magnesium, it's zinc, it's vitamin B12, it's vitamin B2, it's iodine, it's tyrosine, it's selenium, it's iron. Iron is also necessary for thyroid hormone conversion. And it's vitamin A, and it's vitamin D, and it's omega-3 fatty acids. So you can see there's a cascade of nutrients there that any of those being deficient can create a type of hypothyroidism that is not autoimmune hypothyroidism, but is in essence a nutritional hypothyroidism. And so again, if you're going to your doctor and he says, hey, you have hypothyroidism, let's put you on this drug for the rest of your life. Now what? There's no solution in that drug, because the drug is just an artificial form of thyroid hormone, and it doesn't replace what your body's capable of making if you provide your body what it needs to be able to make that. But the other big problem with thyroid medications, and many of you, because many of you answered the question that you were actually, you had thyroid was one of your main complaints, that you want to understand is that Synthroid, which is one of the main forms of thyroid medication, actually has corn in it. And so going back to, are you really on a gluten-free diet? One of the aspects that we have to investigate and look at is we have to look to see whether or not corn is part of the problem. And if your medications contain corn and you're not getting them compounded, well, you're going to run into a big problem as you move through the process, because corn has got a form of gluten in it that will cause and create the same kinds of problems. So again, hopefully that, I know I went a long way to answer that question, but I felt like it was important to get you the information appropriately without leaving anything out. So here's another question. Let's see here. Okay, so Kimberly's saying, hello, Dr. Osborne. I have selected chronic fatigue as it's the hardest to deal with, although has a few other immune issues, which I would love to have better understanding of. So chronic fatigue, we've got to go back and we've got to ask some fundamental questions. What does the body need in order to generate energy? If the body doesn't have the nutrients necessary to generate energy, chronic fatigue is never going to go away, no matter how much you change your diet. Now, certainly, one of the fundamental tenets to addressing chronic fatigue is to find out what you should or shouldn't eat. Because if your body is eating foods that you're allergic to or reactive to, then what ends up happening is, instead of food being a nutrient, food becomes a detriment. Food actually becomes a hindrance on your body as opposed to a benefit. And if you have a chronic fatigue situation and you're eating the wrong food, you'll never, ever overcome that process. Now, what also happens with chronic fatigue is many people have vitamin and mineral deficiencies. And these vitamin and mineral deficiencies tend to lead to, or tend to create or cause, an inability to properly produce the energy necessary for your body to produce. There's a compound that all of us make called ATP, adenosine triphosphate. And ATP in our body is the same. It's like money in the real world. In other words, to pay your rent and to buy gas and groceries, you've got to have money. But in your body, you've got to have this substance called ATP, because it's the thing that pays the bills inside your body. And if you don't make or generate enough of that, you're going to suffer with chronic fatigue. So chronic fatigue generally, again, if you've got nutritional deficits, if your doctor hasn't adequately measured your nutritional status, that's one of the first things that I would rule out. That between what you eat and what you're deficient in. So what nutrients that you're lacking, and what foods that you should be eating that you're not getting, or what foods that you're eating that are creating damage, so that you can remove those from your diet. But one of the other big aspects to chronic fatigue can come from infection or co-infection. So like a Lyme disease or Epstein-Barr virus or a yeast infection or a parasitic infection. So all of those things really should be ruled out in order to get a good fundamental establishment of what of where that origin of your fatigue is coming from. So anyway, I hope that was a helpful kind of starting process for you. Okay, again, if you haven't picked up a copy of No Grain, No Pain, you can pick that up early at Amazon now. Its published date is January 26th, but if you pick it up early, you get a package worth $200. And that package, again, it's got coupons, but also it has a week worth of workouts in it. So there's a workout videos that you get access to from a good friend of mine at Turbulence Training. So anyway, it's a great package. If you haven't gotten your copy, make sure you go pick it up now. I'm going to ask another question, because I want to kind of get a feel for, again, for where everyone is. And so let's ask this question here. How many of you are on medications? And if so, how many medications are you on? And I'm going to give a couple minutes for that. Okay. somebody's asking me, let's see here. It's Kimberly. Kimberly, thanks for the question. What is my opinion of rice? Rice is horrible. Not only is rice extremely high in terms of carbohydrate, so it will cause a hormonal fluctuation change. What rice will do is rice will spike your insulin and your blood sugar, and it can create hypoglycemia, hyperglycemic rebounds, and contribute to diabetes. As a matter of fact, the Asians have the highest rate of diabetes of any other people in the world, and a large reason why that is because of rice. But rice also has a form of gluten. As a matter of fact, a little bit of history. It's just a little bit of trivia. The Great Wall of China is actually made out of, the mortar is made out of rice gluten. And it's the longest and oldest standing structure known in the world, and it's held together by rice gluten. So what does that tell you about the structure of rice gluten? It's pretty rigorous stuff, probably hard for our digestive tracts to be able to break it down or adequately or appropriately. But rice is also grown, many breeds are grown GMO, many breeds have lots of pesticides, but rice is known to be high in cadmium and arsenic, and both of these toxic metals are known contributing factors for autoimmune disease. So if you're substituting, your wheat or your barley or rye grains for rice breads or rice pastas or rice cereals, you're not going to recover. I've seen enough of this over the last 15 years in clinical practice to know that rice is one of the biggest issues. And as it relates to chronic pain, rice is probably one of the worst as it relates to chronic pain. Meaning that rice is one of those big triggers for pain. And when I say pain in this situation, I'm really talking about joint pain, joint swelling, and muscle pain. Rice is notorious as a cause for those. So you want to make sure that that you understand. That's my opinion of rice, not something that I would really recommend that you consume. Again, no grain, no pain is the name of the book, and the no grain aspect is why what I want you to grasp from this webinar. No grain, all the grains: wheat, barley, rye, oats, sorghum, rice, millet, corn, okay, are some of the main grains that we use here in the United States. So looking at the medication list, we've got 41%, almost half of you aren't on any medications. Kudos to you. Kudos to you for hopefully trying to find a better solution than drugs. 27% of you are on one medication, 9% on two, 10% on three, 5% are on 4, and 8% of you, almost 10% of you, on 5 or more medications. I would simply say this: if you're using multiple medications, you really need to seek out a functional medicine doctor and find somebody who's versed and knowledgeable, because those medications long-term are not going to be viable solutions. They may be patching you together in the meantime, but they're not going to be long-term viable solutions. And I just don't want you to end up thinking that over the long haul that those are going to be things that are going to get you and keep you healthy as you move through the process. Okay. Now I want to share some stories with you, because I think understanding that understanding some of these some of the impacts and the way that people can respond to the right diet, to the right lifestyle, I think those are powerful elements. And I think if you understand those things or you see them, I think it might create create some ideas for you to go to back to your doctor with. So we're going to just pause for a minute. I want to not pause the webinar, but I'm going to show you a video. And so my talking is going to pause, and this video is going to load, and I just want you to watch this. And this is an actual patient who suffered with cancers in a type of pain called ascending paralysis, where she was losing the function of her limbs. So we're going to play that video. Okay, so again, I just wanted to share, and I've got some other stories I'd like to share with you tonight, but I want to share those very, very powerful stories with you because many of you are probably still struggling, whether it's to get better, to overcome that proverbial health hump. And I just want you to know there's light at the end of that tunnel with a little bit of good guidance and with doing some of the right things. So let's get on to there's some of the questions. I was going through some of the questions while that video was playing, and one of the questions came back, and I really think that we need to answer this question because it's another one of those issues. A lot of people use completely the wrong type of testing when it comes to trying to identify gluten sensitivity. Now, again, when I say gluten sensitivity, I really mean grain sensitivity, meaning that a person should not eat grain, not necessarily that a person should not eat wheat, barley, or rye. And so I want everyone to understand that gluten sensitivity cannot be diagnosed using blood tests. And one of the reasons why is because if the blood test comes back and we have a negative test, it doesn't mean that a person is not gluten sensitive. It just means that a person is not gluten sensitive in the manner in which they were tested. So let me define that for a minute. There are 7 different ways the immune system can react. Okay, 7 different ways. When we're measuring for gluten sensitivity, and the example of these tests would be like an anti-gliadin antibody test or an anti-tissue transglutaminase test or an anti-endomysial antibody test. These types of tests are only measuring really primarily to see whether or not a person has end-stage celiac disease. They're not really sensitive for gluten per se. They're really just going to come back positive if somebody has really late-stage gastrointestinal villus atrophy or severe gastrointestinal damage, and they're in the late stages of gluten sensitivity. These tests don't come back highly accurate in earlier stage. So a person can be gluten sensitive and have negative test results and go 30, 40 years and not get the right diagnosis until the damage is so extensive that the gluten tests actually come back positive. That's why we don't ever use serum antibody testing to measure for gluten sensitivity. Even some of the bigger labs that measure some of the progressive things, like they measure different forms of grain or different forms of gluten. There's one lab out there that measures for wheat, barley, rye, it measures for rice, and it measures for corn. But even that lab is not all that accurate in terms of well, it's accurate if it's positive, but it's not necessarily accurate if the test results are negative. And the reason why is wheat alone has several hundred forms of gluten. Corn has different forms of gluten. Rice has different forms of gluten. Barley has different forms of gluten. The most progressive labs in the world only measure for 12 different kinds of gluten. I just said wheat alone has hundreds of types of gluten. So it's important that you understand that if you're measuring an antibody response to gluten, but you're really only measuring for a handful of these different types of gluten, and you're not being comprehensive at all at measuring for all the different forms of gluten, then what will end up happening is you'll get a false negative result. Now, really the only way to truly measure for gluten sensitivity is to do genetic studies. In genetic studies, what genetic testing, there's a particular gene pattern that we look at. The gene pattern is called an HLA-DQ gene pattern, and there are different patterns that people have. It's almost like a SNP, if you've heard of SNP testing or DNA methylation testing. People with gluten gene patterns shouldn't eat gluten because people with gluten gene patterns are going to react to gluten if they get exposure to it. So if you haven't been genetically tested, you could have an antibody test come back negative, and it's not because you're not reacting to gluten. It's just that you're not reacting to gluten in the very specific way that that test was done. Remember, we make 5 different kinds of antibodies, and then we have 3 other types of immune responses that can occur. The only thing that these lab tests that are measuring for gluten sensitivity actually measure, they measure 2 kinds of antibodies, and that's it. So you're missing the other 3 kinds of antibodies, and you're missing the other 2 ways that the immune system can respond. So those types of tests to measure gluten sensitivity are very inaccurate. They're very misleading. And again, genetic testing doesn't tell you whether you are reacting to gluten. It tells you whether you will react to gluten should you get exposure. And that is infinitely more valuable piece of information to have than knowing whether or not you are currently reacting to a certain kind of gluten. So it's very, very important that you understand most gluten sensitivity blood tests are highly inaccurate, highly misleading. If you really want to get a definitive answer as to whether or not you should be gluten-free, you need to get genetic tested. Genetic testing is the only way to rule it in or out with great degree of certainty as to whether or not going gluten-free is the right thing for you to do. So very important that you understand that. I have had more patients from all over the world come to me saying, I've been tested for gluten already and I'm not gluten sensitive, and they were, and they'd gone 20 years eating gluten after they'd been told to eat gluten because their doctors told them they weren't gluten sensitive, not because their doctors were right, but because their doctors didn't have a higher understanding of the science behind gluten sensitivity. Again, that's one of the main reasons I wrote the book, No Grain, No Pain. It's got more than 350 peer-reviewed medical references in it. And I wrote it to share and spread and disseminate the information so the rest of the world could have access to this knowledge. And this is just what I'm giving you tonight is just a preview. It's just a preview of what's in the book. So again, if you haven't picked up the book, I highly encourage you to grab your copy now. One of the reasons, obviously, is because you know, I want you to get educated. But the other reason, you know, from a side note, is that you know, if you pick up your copy now, you get a bunch of bonuses that aren't going to be available when the month ends. So I want you to be able to get access to those things because, you know, sometimes initially going gluten-free can be expensive, and I want you to save as much money as you can as well in the process. So let's ask, we're going to pull up another poll here. And I want to get, again, I want to get a feel for how many of you have really struggled in trying to find a solution. So how many doctors have you been to? And I just like your honest answer. How many different doctors, how many doctors have you all been to over the course of trying to get an answer, trying to get a solution? The average patient that comes to see me has been to 7, 8 doctors. And that to me is a travesty because nobody should have to go see that many doctors before they can find a real solution. It's not that I'm the smartest or smarter than anyone else. I've been trained, highly trained in nutrition. I've been highly trained in functional medicine. To me, it's like, no duh, doctors should be trained in those things. Those are fundamental sciences. It's just sad that not all doctors get that type of education. So I'm going to leave that poll up for a few minutes, and let's get some answers as we come back. So I'm going to answer a couple different questions that are coming in. This one's coming in from Sandra. Does having 2 copies of the HLA-DQ8 genes mean you're gluten sensitive? Yes, it does. That's a great question, Sandra. There are 4 types of gluten positive gene alleles. And so a gene allele is a piece of a gene. And so there are 4 patterns that we look for when we're doing genetic testing. HLA-DQ8 is one of those patterns. So if you've got 2 of those, you're definitely gluten sensitive. Now, you may not have celiac disease. Remember that everyone with celiac disease is gluten sensitive, but not everybody with gluten sensitivity has celiac disease. Very important discrimination and delineation. Gluten sensitivity is not a disease. It is a state of genetics. But if you have gluten genes and you eat gluten, you will develop disease. There are over 190 known diseases that we have seen gluten cause or contribute to. And so it's very, very important that you know that. So HLA-DQ8 is one of those genetic patterns. HLA-DQ2 is one of those genetic patterns, and there are 2 others, HLA-DQ1 and HLA-DQ3. So most doctors, if they do what's called celiac genetic testing, they're not measuring for HLA-DQ1 and DQ3. They're only measuring for HLA-DQ2 or DQ8. So if you aren't a DQ2 or DQ8, but you are a DQ1 or a DQ3, you could get a false negative. So if you're going to do genetic testing, as a matter of fact, since we're on the topic, I'm just going to put up a link here for you guys to learn more about genetic testing. And we're going to load that up. And actually, I twisted some arms before this webinar because the price of genetic testing, the cost can be a little bit expensive. But we actually got the lab to discount their cost by $50. So if you use that promo code, if you grab a copy, use the promo code DNA when you check out, and you'll save $50. So that actually, they only gave that to us for the next 24 hours. So make sure you take advantage of that promo code. Otherwise, it'll go away. And if you're thinking about getting tested, you're serious about getting tested, I highly recommend, if you don't know whether or not you need to go gluten-free, to get tested so that you can have that information. Because again, it's not a disease, it's a state of genetics, and your genes don't change. That's the one thing we know fundamentally, your genes won't change. So if you have gluten sensitive genes, that means gluten-free forever. That doesn't mean gluten-free for 6 months or 3 months or a 2-month trial. That means gluten-free forever. And then you got to get educated, because there's a 12-week learning curve to going truly gluten-free, where you actually truly get all the grains out and you get your your pantry locked and loaded, and you get your traveling down, and you get your social conversations down, where gluten becomes an easy part of your life as opposed to gluten becoming a huge daunting task. Okay, let's go down and look at our survey here. So as far as the doctor poll is concerned, how many doctors have you been to? 24% of you answered 1 to 2. 38% of you answered 3 to 5, and 38% of you also answered 5 or more. So, you know, almost half of you been to 5 or more doctors and still struggling to find a solution. That's I'm sorry that you've had to go through that. That's, you know, that's a travesty. Somebody's asking now, is 23andMe a good test? Not for genetics for gluten sensitivity. 23andMe will not give you the breakdown of genetic alleles for gluten sensitivity. So if you use them, you're not going to get the full comprehensive information that you need to be able to find that information out. That's a good question. Thanks for submitting, Lisa. Another question coming in from Brenda. Is there gluten in ground coffee? I heard it might be in it. Thoughts about coffee in general? That's a great question. I actually wrote an article on Gluten-Free Society about a year ago on this very topic. No, there's technically no gluten in coffee, unless that coffee is like an instant coffee and it's got corn fillers or wheat fillers added to it. So if you're buying whole coffee bean, you don't have to worry about gluten. There's no gluten in whole coffee bean. It's when you buy those instant coffees or those coffees that you stir up, they generally tend to have grain-based fillers in them, so you have to be real careful. My advice on coffee is, look, if first of all, if you're using coffee, a lot of people use it for their energy. Caffeine can be a problem. Long-term use of caffeine on a consistent basis it can cause B vitamin deficiency and magnesium deficiency. It can overwork the adrenal glands. And so if you're already struggling with gluten and you're already struggling with food allergies and vitamin and mineral deficiencies, consistent use of coffee when you're trying to recover from a chronic autoimmune pain can be a big roadblock for many people and can contribute to them not being able to get better. So coffee is one of those things that a lot of times I'll recommend my patients avoid for 3 to 6 months as we're initially going through the process of trying to get them to overcome. And it's because there's several reasons why. One, there's a lot of pesticide in coffee. Now you can buy organic and you can eliminate or alleviate the pesticide issue, but coffee also has a lot of mycotoxin potential. Mycotoxins are basically toxins that are produced by mold spores that can cause immune system problems. And so a lot of people who are already in chronic pain have a lot of immune system problems. The exposure of mycotoxin in coffee can contribute to them not recovering or not getting better. Coffee also, again, has caffeine, which overstimulates adrenaline output and is a diuretic. So it can cause you to lose vitamins and minerals in your urine. And so if you're trying to overcome vitamin and mineral deficiencies, it can pose a real problem. So good question on coffee. Bottom line is, if you're chronically ill, it might be a good idea to avoid it for a little while. I actually test all of my patients for coffee allergy as well. And when I test a patient for allergies, I want to know not just about food, but I also want to know about food additives and food dyes, and I want to know about pesticides, and I want to know about petrochemicals and environmental chemicals. Not just food, right? Not just food, because sometimes it's these other environmental triggers and chemicals that can also contribute to disease. So a comprehensive allergy test is one of those things, if you haven't had done, very important to get done. Question coming in, another question. How much longer do I need to wait before the neuropathy goes away? Is that reversible once I'm 100% grain-free, gluten-free diet? I have numbness in all my toes and pain in my feet every night. So Annabelle, great question. The answer to that question is I can't answer that question because you're not a patient of mine, so I can't examine you and discern why the neuropathy is there in the first place. But I'm going to give you an answer based on some of my experiences with working with patients who've had symptoms that are similar to yours. The type of neuropathy that you're describing to me, okay, is usually a vitamin B12 deficiency neuropathy. When we start to have numbness and tingling in our toes and then it moves up into our feet, it's usually as a result of a demyelinization process, meaning that the nerves have this insulation that wrap around them. It's called myelin. There's a disease called multiple sclerosis, which is a disease where the immune system attacks that coating around your nerves and eats it away, and so the nerves start to malfunction. Well, in this type of neuropathy, vitamin B12 deficiency is very commonly a cause of that foot pain and that foot neuropathy syndrome. So that's probably, in my experience, one of the more common. I would go back again, check out that methylcobalamin. I posted a link up to it earlier, and see if that doesn't help you. Going grain-free and gluten-free can definitely help if you have an autoimmune process where eating grain is causing your body to destroy that myelin coating around your feet. So, you know, there's more than one reason why a person might have a neuropathy in their feet. One of them is an autoimmune process, and one of them can be a vitamin deficiency. So to answer your question, how long before you see a change or a reduction, it will vary greatly. For most people, it's at least 2 months. And with severe nerve damage, we can see it take even much longer to heal, 6 months plus. But most people notice an improvement. And I say an improvement meaning it's not healed, but a definite reduction in pain, a definite improvement within a couple of months. So hopefully, Annabelle, that was a helpful question. If you're taking, Annabelle chiming in again, she's taking a liquid B12 for 6 months. Check it. If it's not methylcobalamin, you need to throw it in the garbage. That's one. Two, it's probably got potassium sorbate in it, which is a preservative that you don't want to put in your body, and it's going to counteract what the B12 is capable of doing. So read your label and make sure that those two things aren't the case. Let's see here. Elizabeth is chiming in. What is my experience with vitiligo? I have leaky gut. I have SIBO, but I'm having trouble healing the SIBO. And SIBO and vitiligo, are SIBO and vitiligo related? What about heavy metal toxicity? Wow, that's a big question. First of all, I would question how you were diagnosed with SIBO. Probably the best way to do that is with a breath test where you drink a sugar solution, and we're measuring breath gases for many hours after that. So if that's the way you were diagnosed with SIBO, then we could officially call it SIBO. But a lot of people think they have SIBO. And by the way, for those of you who don't know what SIBO is, SIBO, it's small intestinal bacterial overgrowth. And the most common symptoms of SIBO are gastrointestinal bloating. So every time you eat, you feel like you're pregnant because your belly just poofs right out in front, and you get a lot of distension and a lot of pain. So SIBO can be a small intestinal bacterial. It is a small intestinal bacterial overgrowth, but sometimes people with FODMAP problems. FODMAPs are kind of carbohydrates found. They're difficult to digest carbohydrates found in a number of different foods that can cause a lot of gas and bloating. So I would question the origin of the diagnosis first and foremost, Elizabeth. I would say, is it truly SIBO versus is it some type of bacterial infection or yeast infection, or is it a parasitic infection, or what else could it be? Is it a FODMAP? Is it a food allergy that you have got that's going on that hasn't been detected? These are all the questions that I would want to have answered, because I never like to, when somebody comes to see me, one of the things I never do is assume that their prior diagnosis is correct. Because if they come in and I'm assuming that the last doctor was right, then why is that patient even in my office? If I'm making that assumption, then obviously the last doctor was wrong because the treatment protocols failed for some reason or another. So I would never assume that the diagnosis was that. Not to say that you don't have SIBO, but I would do my investigation to discern whether that was. Vitiligo is an autoimmune disease where the skin is depigmenting. So we're losing the pigmentation cells of the skin, and the skin's starting to bleach. It's starting to turn white. Very much autoimmune, a lot less to do with SIBO, a lot more to do with leaky gut. Leaky gut is a precursor to autoimmune disease. So, you know, my thought process there would be, if you've got a vitiligo response, you need to figure out where the autoimmune disease is coming from first. Remember the 4 causes we talked about in the beginning of the webinar. Cause number 1, infection. Vitamin and mineral deficiencies, number 2. Food, number 3, and chemicals, number 4. You've got to have comprehensive lab value or lab workup to rule out those many different things. My experience, I've seen people with vitiligo repigment, and I've seen people with vitiligo later stages where they've lost a lot of their pigmentation, not repigment, but I've seen them not get worse. In other words, sometimes people will regain their pigment if you can catch it early enough, and sometimes you can stop the aggressive nature of the vitiligo spreading. And sometimes you won't see repigmentation. So it depends on the person, and it depends on the cause, and it depends on the compliance of the person. You know, as the doctor lays out the treatment protocol, if the doctor is actually correct and the patient's not compliant, then obviously the patient won't get better. So there's a lot of factors there. I know I can't answer them all exactly to you specifically, but I hope I gave you some things to chew on. As far as heavy metals need to be ruled out, because lead and arsenic and cadmium and mercury can all trigger and contribute to autoimmune disease. So, so yeah, absolutely. Those things are all possibilities. Those things can all be related. Okay. So let's pull down this poll now that we have a good idea. I'm going to ask another question here. I want to get a feel for kind of the range of when you started to experience, when you started to develop your problems. So at what age did you start experiencing your pain? You know, for some people that comes third to fourth decade of life. For some people that comes early on. Let's let that poll run for a little bit and see if we can't get some good information back from people. Okay. Since we were talking a minute ago, the question came up, you know, about leaky gut, and one of the things that can be done, and one of the things that I really like to help with a leaky gut is something called Ultra-Immune IgG, and this is a cholesterol whey peptide concentrated with antibodies. And what it helps to do is it helps to seal the gut. So it's one of those things that I really like to use in patients who have long-standing leaky gut and they're just challenging and not healing as well, or not recovering as well. Christy's asking, can I tell you more about the coupons with the book? Are they all for products on the website? No. So one of the coupons for pre-buying the book is a $10 coupon code for any product on my website. But all of the other coupons within that pre-order is they are to different companies. So, you know, we offer discounts to cosmetic companies, and there are a couple different cosmetic companies in there. There's some paleo companies that sell grass-fed jerkies and grass-fed beef products and grain-free granola products. So there's a number of different companies in there that are just giving discounts and coupons to their different services and products, including Vital Choice Sea. There's a $25 coupon in there to Vital Choice Seafoods. There's, you know, so it's not just limited to our website or to supplements. It's limited to real food. It's limited to things. These are actually companies that I personally use and that I personally recommend to the patients who come through my office to make their life easier. So, Christy, I hope that answers your question. Mary is chiming in with a question as well. Do I use stool testing with Interolab? No, I don't, and there's a reason why. Interolab measures IgA. Now, IgA is one type of antibody that we can produce. Remember earlier I said there's 5 different types of antibodies that we produce, and so if I'm only measuring one of the 5 different types of antibodies, I can get a false negative test result, and then I can get really confused as to whether or not I'm avoiding or eliminating the right or wrong foods. That's one of the reasons why I don't use Interolab in my clinic testing my patients. I love what they're doing at Interolab in terms of spreading the word and spreading knowledge and education about gluten sensitivity. It's just that the lab testing technology and methodology that they use is limited in terms of its ability to detect IgG and IgM and IgE and IgD. Those are the other 4 different types of antibodies they don't test for, but they also don't test for what's called an immune complex response, and they don't test for what's called a T cell response. So we're missing a lot of those immune responses. And so again, they do good work, but it's just not comprehensive among the array of testing for all the different ways that we could have an allergic response to a food, which is why I don't use them. Realize that in my clinic, I have to be very meticulous about the different labs that I bring in and that I use with my patients, because my job is to test and not guess. As you saw in the survey before, the vast majority of you have been to 5 or more doctors. And by the time you get to me, the guesswork needs to end. My job is to be very objective and to lay out a blueprint for my patient to follow exactly. So I want to leave as many questions I want to answer as many questions up front objectively through scientific validation as I possibly can. And so I can't have missing pieces of information within the labs that I'm using. Okay. Another question from Rachel. Or Rochelle, I don't know how to pronounce it, so if I pronounced it wrong, I apologize. Do you consider thyroid antibodies under 30 remission? No, not under 30. I consider thyroid antibodies under 9 a remission. there's still work to do. So if you're at 30, you've still got an autoimmune process that's occurring, probably a lot better than what it was originally if it's come down. Most people, when they get their diagnosis, you're looking at 300 plus, but 30 is still considered an autoimmune process. And so definitely have a little bit of work to do, but you've probably also come a long way. So don't lose heart, just keep pushing. Let's see here. Are all of my supplements excipient free? Lisa, chime in again and define excipient free. I want to make sure I answer your question with the right understanding of what you mean by excipient. Okay, let's go down to our poll. So the vast majority, there's a number of reasons why I'm doing these polls tonight. One of them is because I want you as the audience to see kind of where you fall amongst other people. I think sometimes seeing social validation is important, and it's a tool you can use to kind of help you stay positive. But two, it's to correlate with the research. The vast majority of patients that I see and that we find to be grain sensitive begin their process of experiencing symptoms from about the age of 35 on. So you can see that, in this poll, 22% of you from 31 to 40, from 41 to 50, 21% of you started to experience your symptoms. And then from 51 plus, 28% of you started experiencing your symptoms. So 70% of you all became symptomatic after the age of 31. Very important to understand that, because a lot of people will go through the first 30 years of their life saying, I've been eating gluten my whole life. I've been eating grain my whole life. I'm fine with it. It's not a problem for me. And then they start breaking down and they never make the correlation. So I want you to see that it's one of those things of bioaccumulation, meaning the damage over time builds and builds. And as that damage over time builds, a person becomes sicker and sicker and loses their ability over time to basically function in their own environment. So they begin to break down and they begin to get sick. So the age is something that just because you've been eating it your whole life doesn't necessarily mean you've been doing the right thing your whole life. Important to understand that piece. Okay, I am going to pull up. I want to share another story with you, and this one, and the reason why I want to share this one is because many of you wrote in with this problem, and so I want to share this particular story. And anyway, we're going to just pause to watch this video real quick, and we'll be right back. Okay, we're back. You know, really, really powerful stories. You know, multiple success stories. Really, really powerful stuff. And again, I just want you guys to have, you know, to have confidence, to have faith that as you pursue your health, that that it doesn't have to be onerous, it doesn't have to be ominous. You can get better. You just have to have the right guidance. You have to look at the right things. So again, those 4 things we talk about tonight that are really, really, if you've got a doctor and you're working with a doctor, those 4 things are the things that need to be investigated primarily, first and foremost. Okay. So now I want to just kind of go through and spend a little bit of time answering a few more questions before we begin the wrap up process tonight. So a lot of people are asking, how do I get genetically tested for gluten sensitivity? I'm going to post up a link right now on this process, the gluten gene test. Again, if you use that link down there and use that promo code on the side of your screen, if you use that, you'll save $50 on the test. Make sure you do that, because that thing will expire here pretty quickly. So, okay. Let's see here. Can altitude anemia be overcome if you choose to live in a higher altitude? It can be overcome, but not if you have an altitude anemia that's also nutritional deficit. So an altitude anemia just shows up more aggressively when you also have nutritional deficiency. So for example, you can live in Colorado at 3,000 feet and your body will naturally produce more red blood cells. But if you have an anemia, those red blood cells still won't work very effectively or very efficiently. So altitude anemia can be, in a sense, overcome, but not if you've got nutritional deficiency that's playing a role within that. Okay. Let's see, other questions here. So Ruth asks, it says about your book, feel better in 15 days and pain-free in 30 days. What about your diet after 30 days? Ruth, I spend an entire 2 chapters in the book talking about what to do beyond 30 days. What I want people to experience is the life change that can happen and the pain reduction that can and that I know will happen if they apply that protocol. And then I want them to have the justification to continue on beyond 30 days. But I spend an entire chapter talking about the exact types of lab tests that you need to have your doctor run on you so that you can get more definitive information. I spend an entire chapter just talking about functional medicine and what supplements that are going to be more effective at improving, the different protocols, the things that you can do to accelerate your progress and to go on and beyond that 30 days. So, I mean, we do get into some of that in the book, but we've got to have a plan of action. And so I wanted to give people who were completely not familiar with grain-free a plan of action, a 30-day plan of action, because I know as well as you know, anybody can do anything for 15 days, anybody can do anything for 30 days, but beyond that, we definitely want to have that plan of action. And that's what, again, in that last chapter of the book, I try to map out what that plan of action needs to be. Okay. Dr. Osborne, when I have been gluten, among my other symptoms are a lot of eye twitches. Is that from a low vitamin level? That's a question coming in from Heather. It can be, but one of the things about eye twitches is that eye twitches can be a sign of muscular damage, and eye twitches can be a sign of neuromuscular problems. So what happens to a lot of people is that gluten will irritate their nerves and create kind of a dysfunctional connection between the nerve and the muscle. And the eyelids and the shoulders and the quads, the thighs are areas where we'll see twitching kind of occur after a glutenized episode, so to speak. So it's not uncommon to see that. Some people, though, also, now, if you notice that it happens only when you get gluten, then it's probably linked to that neuromuscular damage effect. But if you notice that it's happening even when you're not getting gluten, it probably has a lot more to do with an electrolyte disturbance. The primary electrolytes that help regulate muscle contractility and relaxability are calcium and magnesium and potassium and chloride. So those 4 primary electrolytes And those can be measured. Your doctor should be measuring those, because if you have a deficiency of any one of those, think about it. If your eyelid is twitching, right? Your eyelid's a muscle. What other areas of your body are muscles that we don't think about? Well, your blood vessels are muscles, so you can get sporadic twitching of your blood vessels, leading to increased high blood pressure. You can get sporadic twitching of your gallbladder muscles, leading to a bile issue where your liver's not secreting bile appropriately or very well. You can get sporadic muscle twitching of your heart, which can create arrhythmias and other kind of symptoms of heart disease that might get overblown or blown out of proportion by a cardiologist who now wants to put you on all kinds of drugs to fix the twitching, so to speak. So yeah, I mean, you want to look into both of those potential possibilities. Question coming in from Kimberly: what is my take on cross-contamination while cooking at home? For example, using the same wooden utensils with gluten intolerance and celiac disease. Like if you're gluten sensitive and you're cooking 2 different meals for your family, I'd have a sit down with the rest of your family and say, look, I can't do this anymore. Cross-contamination in the kitchen is a very, very big and a very, very real issue. And remember that wood is very porous. So if you're using wooden utensils and you're stirring grain with one, and you use the same wooden utensil, even though maybe it's already been washed, like a cutting board, etc., to prepare your own food, then you're going to end up getting cross-contamination. My advice is because gluten sensitivity is genetic, usually when we really start digging into families, we start seeing more than one member of the family actually is gluten sensitive and needs to go gluten-free. And that would be where I would start that conversation is, look, I may be the one in the house with celiac disease, but how many other people in the house actually should or could or would benefit by going gluten-free, and answering those questions first. Okay. Do I recommend protein powders, and if so, what kind? I try not to use too often, but sometimes just need the convenience. Rachel or Rochelle, again, if I say your name wrong, I apologize. Another good question. The answer to that question is yes, I do actually recommend protein powders. Not as a mandatory. In other words, you don't have to be on protein powders to in order to sustain, but it can be a convenience factor. Well, what I'm going to do is I'm going to put up a link for you right here, and I think everybody will be able to see this link. But what that link is it's a link to convenience factors, and some of those are protein powders. A couple of them are ones that I manufacture primarily because we have a strict criteria for our manufacturing process, so I know it's grain-free. One of them is vegetarian-based protein powder, the other is not. And then there are some other things within that list that could also help you out. We have a grain-free bar that we manufacture. We also have a grain-free vegetable powder that we manufacture for people for that same reason, for that convenience, that travel reason. What do I think? Okay, Pat chiming in, what do I think about standard processed products? I think Standard Process is a great company for people who aren't gluten sensitive or grain sensitive. The problem with Standard Process, I mean, they have a great product, but if you're grain sensitive, the vast majority of their products contain some form of grain or grain byproduct. So for that reason, I don't use them at all in my clinic, and I don't recommend people with gluten or grain sensitivities use that brand because of that reason. So they're not a bad company. They're just not a good company for people with grain sensitivity issues. Okay, another question. Is dairy okay, or is dairy a no-no? From Brenda. That's a great question, and that's a very, very long answer. Yes and no is the answer to that question. Dairy can be a no. Any processed dairy, first and foremost, is going to be a no-no if that dairy is processed with an industrial enzyme called microbial transglutaminase. Now, you won't read that on the package. It either will be or it won't be, but it won't say microbial transglutaminase on the package. Most manufacturers of dairy products use an industrial enzyme with their dairy, and what it does is it preserves the shelf life of the dairy. But when you subject dairy to MTG, microbial transglutaminase, you actually make the casein, which is the protein in the dairy, you make that casein look a lot like gluten. So then you end up getting a dairy product that actually behaves like gluten. And this is why a lot of people do better eliminating the dairy completely out of their diet. Now, some people do better eliminating the dairy out of their diet, and it has nothing to do with an immune response. It has to do with dairy intolerance, meaning gluten has destroyed and damaged the enzymes in their gut to such a great degree that they can't process dairy when they do try to eat it, and so it causes the intolerance reaction causes a lot of gas and bloating and irritable bowel syndrome symptoms. So keep that in mind, that dairy can be bad for more than one reason. Dairy can be bad for multiple different kinds of reasons, and it varies from one person to the next. On that same note, I'm gonna put up another link here for you guys. This is a digestive enzyme. This is one of my advanced formulations, and what we use this particular formulation. One, it's got digestive enzymes in it that will break down gluten and gluten-based proteins. Two, it's got digestive enzymes in it that will help you to break down your other food as well. So, but it's actually also designed for people who've had their gallbladder removed. So if you've had your gallbladder removed and you have a hard time digesting and processing fat because you don't have a gallbladder, this digestive enzyme, I actually formulated it with a higher level of enzymes to help to break down fats. But again, it does have enzymes that break down gluten. So between that one, its name is Ultra Digest, between that one and the other digestive enzyme that I use in my clinic and with patients called Gluten Shield, using one, you don't have to use both of those. Using one or the other is very, very effective. So if you're, for example, if you're traveling while you go out of town, and you need protection from cross-contamination, or you're worried about, eating out and the potential for that cross-contamination or gluten exposure, I highly recommend using one of these types of digestive enzymes to minimize your risk and to minimize the damage that might come from that exposure. Jamie's chiming in with a question. What do I think about the sprouts of grains? Sprouts are no better than the non-sprouts. So I mean, just because a grain is sprouted doesn't make it better for you, or doesn't make you less sensitive to it just because it's been sprouted. That's actually one of the big kind of myths that are out there, is that sprouted grains are somehow healthier and better for you. Sprouted grains actually contain some chemicals that are more detrimental to you. One of those chemical classes is called an ATI. An ATI is also known as an amylase trypsin inhibitor. And this type of chemical protein found higher in sprouted grain will actually shut down the pancreas. It will shut down your pancreas's ability to make digestive enzymes. So in that aspect, sprouted grains are actually worse for you than not sprouted grains. Okay. Let's see here. We've got a few other questions that are coming in. Let's see. I'm getting a lot of people saying they can't see the link. Look over in the side of your webinar screen. There should be, it should say over there on the side, it should say offers. There should be a tab that you can click with a little like microphone looking symbol or megaphone looking symbol that says offers. And if you click on that, you can pull that up and you'll be able to see it. Hopefully that gets you there. Okay. Let's get a few more questions answered. What are my thoughts on consuming beans and legumes? Good question. It depends. Beans and legumes are extremely challenging to digest. They have a hard outer shell, and they have a number of families of proteins within them that can inhibit or shut down your own digestion. They're also very, very rich in a compound called lectins, and lectins can create a molecular mimicry process that leads to joint pain, leaky gut, joint pain, muscle pain, etc. So it really just depends on the person. I like to test. I like to discern whether or not a person should be able to do that. But my advice on anybody who's having gastrointestinal distress, having a really hard time with digestion, is to avoid beans and legumes anyway, because at least for a while, maybe not forever, but at least for a time, as we're trying to restore gut function, as we're trying to heal the gut. Think of the gut again. Think of the gut if it's damaged and you ask it to do more work, and the work you're asking it to do is harder than what would typically be done by the gut, then it's going to slow down our ability to heal and recover. So beans and legumes can be that for some people. And so you have to be cautious with that food group. Okay, our question coming in from Danette: am I accepting new patients, or do I recommend a practitioner in Fort Worth? So yeah, I do accept new patients, but we're booking right now. I think we're booking out in March, so it takes a little bit of time to get in to see me. As far as recommendations, I do have a training program. If you go to glutenfreesociety.org, there's a link on top. It says GF Doctors, and then you can find doctors. There's a map that you can pull up, and you can look for doctors in your area. Those doctors that are on that website will have a little gluten-free icon by their name. Those are the doctors. The ones with the little icon by their name are the ones that I have personally trained through my I have two programs. I have a 2-hour postgraduate program on gluten sensitivity and autoimmune disease, and I have a 10-hour postgraduate program. And if those doctors have gone through my training, they're listed on that site with those little icons by their name. So if they're on the site but they don't have the icon by their name, then they're not somebody that I can formally say, yeah, I know that that doctor knows what I know. But they're doctors who are claiming they have an expert knowledge in gluten sensitivity. But the ones with the icons are the ones that we know that we've trained through our training program. So hopefully that's helpful for you. Shasha is commenting, 23% of supplements may have hidden gluten. That's not true. 23% of supplements only going to have hidden gluten if they're manufactured in facilities that actually don't take the right precautions. Now, some people that use LDN, which is an acronym for low-dose naltrexone, which is kind of an immune suppressant. In 15 years of clinical practice, I've never seen the need to actually apply LDN. That, again, that doesn't mean that it's not necessary or that it's never helpful or beneficial. But my thought process there would be, what else is going on that's continuing to create an immune response that would kind of create a need to suppress the immune system using a medication like LDN? Okay. Let's see. My opinion on fermented grains, again, it's the same thing as sprouted grains. My opinion on fermented grains is avoid it. If you're gluten sensitive, again, if you're not gluten sensitive and you don't know whether or not you should avoid grain in general, I can't really comment. But if you are grain sensitive, gluten sensitive, if you're positive genetically, it doesn't matter whether it's fermented. It doesn't matter whether you soak it. It doesn't matter whether you sprout it. You're reacting to the classes of proteins found within the grain itself. And so all those procedures are not going to get rid of all those different classes of proteins that you could be reactive to. And it's still going to create a big potential problem for you. Okay. Is leaky gut a prerequisite for all autoimmune diseases in addition to the 4 causes you mentioned? No. That's kind of one of those myths too. You do not have to have leaky gut to develop autoimmune disease. You could actually have leaky lung. If you've ever had or heard of asthma or bronchitis or chronic obstructive pulmonary disorder, these are diseases where the lung barriers have actually been breached. And so when a person is actually breathing, they can breathe in chemical toxins that can get into the bloodstream that can create and trigger autoimmunity as well. So you do not have to have a leaky gut. You can also have a skin breach, where if you've got chronic, highly inflammatory skin disease, you can have proteins that are leaking through into your skin, into your bloodstream, and that can contribute to or create or cause a leaky, not a leaky gut, but an autoimmune process. So leaky gut is not the only prerequisite. It's just the one that's the most commonly discussed when you tune into some of these online seminars and online summits. Certainly it is a cause, but other leaky barriers can contribute to autoimmune disease as well. Kimberly's chiming in with a question: can grain-fed meat be a problem with gluten intolerant? Absolutely, it can be. But grain-fed meat we've not studied whether or not the meat contains gluten. We only know that when cows are primarily fed grain, they're also fed tons of antibiotics. And so what ends up happening is the antibiotics end up showing up in the cow's meat. And so when you eat antibiotic-loaded meat, what you're actually doing is destroying your gut flora, and you're predisposing yourself to hyperreact to gluten when you get exposure. So your reactions are going to be even greater. Wynn is chiming in, 100% grain-free is very hard to do in the real world. Even when you read all the food labels, reduce the exposure to grain seems also helpful. Does this mean we haven't found the true mechanism? No, I would disagree that your contention is that being grain-free is hard to do. I would say it is hard when you're initially going about it, but the longer you experience it, and the more skilled you get, and the more you apply it, I'd say the easier it becomes. I wouldn't say at all that, I mean, yeah, there may be some other mechanisms behind the scene. I will never say that there aren't potentially possible other mechanisms, because we don't know everything. We only know what we know. But grain-free in and of itself, let's not give that more credit than what it deserves. Let's not make that process so hard that we deter other people from being able to positively embark upon that lifestyle and feel like it's so overwhelming that it's impossible to do. Do I accept distant patients via Skype or phone or email? And the answer to that, Celia, is yes, I do. You can call my office. It's easy to find my office online. If you just you can actually, you can go to drpeterosborne.com and get that information. I can also type in my office phone number for any of you who feel the need to get additional help or want to come in. So there's my phone number. I just typed it in. So let's answer a couple more questions. I'm going to go for about 15 more minutes before we start to wrap it up, and then you know, maybe we might do this again. I don't do webinars very often. My schedule is just really super busy. But I felt like this information was important enough to get out there. Okay, I'm going to put up a copy or a link to the book. If you haven't gotten the book, that's one of the best ways to get kind of the nitty-gritty information and details about some of the things that I do in my office, but also to be able to get on track, to be able to get your life back on track. If you're still suffering with chronic autoimmune pain, you really want to be able to find some answers. That's going to have a lot of those different answers in it for you as well. Okay, let's see here. Somebody's chiming in. Christy's asking about wheatgrass. The fundamental problem with grass in general is grass is generally toxic to humans. 40% of the population has grass allergy. I don't recommend eating grass as food. One of the reasons why I have a greens drink that is completely grass-free is that reason right there. This is a great question. When humans eat grass, there is a risk of grain cross-contamination. Remember, grain is the seed of grass. And so depending on, like, let's say you're using one of those greens drinks, you know, what if somebody accidentally, or, you know, we have humans that make mistakes. What if grains and grain seeds are actually getting into their greens drink? Then you get gluten cross-contamination. You run that whole risk of drinking those things and getting contaminated. My thought process would be avoid grain-based foods, including grass-based drinks. It's not something I recommend. So Karen's asking, how can I avoid rice or corn fillers that are usually in supplements? Very easily. I dictate the way they're manufactured, so I get to choose the ingredients and I get to choose the source of the ingredients. So there are a number of different rice and corn-based fillers, and I have a very, very strict no grain policy in anything that I formulate. So it's very, very easy to avoid grain-based fillers. There's lots of other fillers that can be used. And going back to another question asked earlier, do I use excipients? Yeah, every supplement company uses some excipient to a certain degree. You have to, because when you're mixing vitamin B6 with zinc, you know, different vitamins and different minerals have different molecular weights, and to get a homogeneous mixture so that you don't have one pill that has 30 milligrams of zinc and another pill that has 10 milligrams of zinc and have, you know, your doses all discombobulated, you have to have some type of excipient used in the mixing process. We just used grain-free and non-GMO excipients. So the excipients we use are non-GMO. The excipients we use are completely grain-free, and they're generally derived from some type of mineral and some type of vegetable fiber. That's generally what we use. There are a number of different vegetables that we use, but they're completely grain-free. So hopefully there were several questions that came through about supplementation, and hopefully that gets most of those answered. What's the most common infection I see in patients? Bacterial, viral, fungal, or parasitic? Probably the most common is a kind of a tie between bacterial and fungal. In the area that I practice in, so people come to see me who are from the local area, I'd say probably the majority are fungal, and that's just because Houston is such a humid climate, and we have a lot of mold growing in the buildings and ubiquitous in the environment. So a lot of people pick up mold from the local environment. When their immune systems aren't strong enough to combat it, they end up with an infection. So not a scientific validation of exacts, but that's generally what we see most of. I do see parasitic infections and I do see viral infections as well, but the other two types are just more common in my experience. Okay, let's see here. I am going to take a couple more questions. Celia's coming in with the promo code's not working for her. If you're having any trouble at all with any of the promo codes, all you need to do is email Sally, and her email is Glutanology, Glutenology, Glutanology @gmail.com, and she will make sure that you get, if you put that order in, she'll make sure to go back and get you that credit, or make sure you get that link or that code working. So if you have any trouble from tonight's webinar, we've put up several different promotions for you guys to check out. If you have any problems at all, again, you can email Sally at glutenology@gmail.com, and she can get you set up and squared away for that. Okay. So Sarah chimes in. I'm getting to the conclusion that grains can be one of the causes of type 2 diabetes because the pancreas is shut down. Insulin production could be impaired. Am I in the right track? Yeah, you are. There's three primary foods that can fuel the generation of type 2 diabetes. And that is, obviously the primary food group there is sugar, and most people know that one already. The second group that we see generate type 2 diabetes is grain, and the third group is dairy. Those three groups will cause a dysfunction in the pancreas and cause a dysfunction in insulin and cortisol response, which can lead to blood sugar fluctuations over time, contributing to diabetes. So definitely good question. Okay, let's do one more. I'm gonna show you guys another story here that I want you to check out. To me, this is probably I'll save the best for last. This is one of the most powerful stories and one of the most powerful recoveries that I've ever seen in 16 years of clinical practice, and that's saying something because I've seen a lot of problematic patients. So I'm going to load this next one for you, and we're going to watch this one. Okay, so we're back. As you saw, a very, very powerful story, and it was again, like I said, one of the biggest transformations that I've seen in 15, 16, actually about 16 years of clinical practice. So very, very powerful story. I'm going to answer a couple more questions, and then we're going to close out. And for those of you who stayed the whole time, I've got a very, very special bonus for any of you who stayed through the entire webinar. So don't check out. If you're hearing me now, don't check out before we end, because I want to make sure you grab that bonus. So Sarah asked, is it the dairy itself, or is it the dairy treated with antibiotics, hormones, etc.? Grew up drinking raw milk, and my family never had diabetes. You know, there's a lot of thought to this. Actually, there's some thought that it has a lot to do with the hormones, that it has a lot to do with the antibiotics that the cows are being exposed to within what they're eating. So the microbiome itself is very, very critical for our ability to process calories. It's very, very critical for our ability to process sugars. And so when we destroy that microbiome, what ends up happening, or what can end up happening, is it causes a sugar disruption or sugar dysregulation. But beyond that, there is a component to casein itself, meaning that dairy in and of itself for some people can trigger and can cause diabetes. Now, we can't make generalized statements saying that dairy causes all diabetes, or dairy is a blanket statement to diabetes, but we can say that there are definitely people, just like there are definitely people with gluten and grain sensitivity, there are definitely people who, when exposed to dairy, it's going to contribute to pancreatic dysfunction that can contribute to diabetes. So hopefully that answers your question on that topic. Last question from Laura. It's we have been gluten-free for over a year. My son is being diagnosed as refractory celiac disease. What else could be causing GI inflammation? We're grain-free, dairy-free. We use your supplements to not have any corn or other contaminants. So Laura, the very first thing that I would do in this scenario is I would have a type of gastrointestinal test done that measures for gastrointestinal infection. I would also rule out any type of gastrointestinal dysbiosis, meaning any of the wrong kinds of bacterial presence, because a lot of refractory celiac disease, if a person is truly grain-free and they're calling it refractory celiac disease, there's two primary things that I have seen clinically that cause it. One is a persistent infection that never got identified, and that needs to be ruled out. And one of the other things is that we have so much damage to the GI tract that the very act of eating is overwhelming and allows for contributing and continual damage to the gut. And in this type of scenario, we've got to put these people on support enzymes, and sometimes much higher doses, even than some of the products that I'm using or that we offer to people online. So you wouldn't use the standard dose, but you might use a much higher dose of a combination of different types of enzymes that are going to help that food process, that digestion process. And even in some of these cases, we have to do fasting, where we actually take food away and we go to a liquid diet for a time to allow for the inflammatory nature of the gut to finally heal. Think of it as a scab. And every time you rub the scab, the wound rips open again. Think of the gut as just one big scab, and that's kind of the way it looks in refractory celiac disease. Is the scab is irritated by anything, and the act of eating becomes an irritant. And so sometimes in those cases, you have to remove the food for a small enough period of time to get the scab to heal over, so that we don't continue to rip it off and cause persistent inflammatory damage. So hopefully that's helpful for you. And get you at least a place where you can begin the process and start. Okay, for those of you who are still on, I'm going to offer another bonus to everybody who stayed on through the end. But there's a catch. There's always a catch. We're working our hardest, and we're working very diligently behind the scene to create a New York Times best-selling book out of No Grain, No Pain. It's one of my missions, and I know that if that happens, then the millions of people's and the lives that this book will change, and that has the ability to change. It's part of my goal. It's part of my dream. And so I want you to help me make that happen. So, you know, one of the reasons, my sneaky little reason, or one of them for putting on this webinar, was one to provide you with great quality information that you could take away and walk away from this webinar and just say, you know what, that was awesome information that we can use. But one of the other reasons I'm having this webinar is because we're trying to sell more of these books before the book even goes to publishing. So I'm going to give you an ethical bribe with the book. So aside from the fact that we're giving away $200 in bonus coupons and bonus materials for anybody who buys the book, and we're going to have a very narrow window. So if you buy the book tonight, and it has to be tonight before midnight Central Standard Time, so that gives you 3 hours. If you buy the book before Central Standard Time, midnight, and email the receipt back to glutenology@gmail, we're also going to throw in a manual on how to heal leaky gut, how to appropriately heal leaky gut, with a supplement guide in it, and all the steps and all the action steps that you can take to make sure that you get that, including the lab tests that you can ask your doctor for, including the things that you need to, if you're working with a functional medicine doctor, the actual tests that you were going to want him to order on you to be able to properly identify and isolate all the different problems, but a supplement manual that goes along with those problems. So anybody who orders before midnight tonight, again, that's Central Standard Time, is going to get access to that leaky gut manual. If you get it in at 12:01, we're not going to give it to you. So if you want to get a hold of that manual and get a copy of it, while also pre-ordering your copy of the book and helping me reach more people at the same time, which I greatly appreciate, then make sure you grab your copy before midnight tonight, and we'll take great care of you. So for those of you who got a lot of great information, I just want to say I'm glad I could help you. I'm glad that you could attend tonight's webinar. And we're going to be posting a rebroadcast of this webinar for you. So if you want to go back and replay it and listen to it, you'll be able to do that. And what I would like from you is your feedback. If you felt like this was a good webinar and it was helpful, I'd like your feedback, because we may do future webinars. It'll depend on my time and my schedule, but we may do future webinars. But my goal with ever doing any of these types of things is that I want to better serve you as the viewers and as the audience. And so if you can give me your feedback on what maybe we didn't talk about that you'd really like to hear, that helps me moving forward into the future, being able to plan something that is just stellar for all of you. So until next time, I hope you all have a great evening. Happy Thanksgiving, and Merry Christmas, and Happy New Year. And we'll talk soon. Take care. Bye-bye.